Cornelia De La Fosse, and I am a consultant psychologist and an EMDR consultant practicing in London. And this is my colleague, Maddie Campbell. We are here to talk about the integration of CBT and EMDR in my work. Both CBT and EMDR are exceptionally effective therapies, but both very different in essence.
Okay, so very different. So can you tell us a bit more about how you would work with these?
CBT works on cognitions, thoughts and beliefs, and making a deliberate change to behavioural patterns that started early in life as coping mechanisms or as a response to anxiety or depression. EMDR is an experiential therapy that works on exposure to memories of past traumatic experiences or disturbing events. These could be one-off car accident or surgery, or having a difficult childhood with critical parents and bullying in school.
So can you give us more of a flavour, Cornelia, of how you would work?
The best way to explain how I work is to look at the structure of the brain and different functions that are performed by different brain areas. I believe that psychological difficulties are largely caused by two main parts of the brain not working together. The human brain, the cortex or the human brain, is responsible for higher order thinking, such as planning, self-awareness or language. The limbic system or the survival brain is responsible for regulating emotions and behaviors needed for survival: fight, flight, freeze or submit response. This part of the brain is working on the idea it's better safe than sorry. When the danger is detected, a stress response is activated with accompanying changes in your body. These changes are made to save you from the danger, to make you stronger or faster, to jump out of the way of a speeding car or run out of the burning building. During the stress response and while your stress survival brain is activated, the human brain switches off. It is not evaluating what is happening to your body or what the other part of the brain is doing. Because in emergency, taking time to think could mean a difference between life and death.
Okay, so that's fascinating. Can you give us an example, please, Cornelia?
Okay, so you're driving in a rented vehicle at night and you are about to cross a narrow bridge over a river. Suddenly you notice a speeding car coming towards you. You react quickly, you swerve and avoid the accident. The car passes, you sigh in relief, you take a deep breath and you continue. You are not aware that the survival brain that makes you act quickly and save yourself took a mental note of every single detail of that incident. The fact that it was night, that you were on the bridge, that you were driving, the color of the car, and filed it away for the future. This part of the brain is now on the lookout for you, scanning for possible threat that match the one that it responded to before. So you work in London and you often cross Westminster Bridge on foot. Your survival brain notices the bridge and the river and remembers that night, and it activates your stress response. It is well-meaning because it wants you to be faster and stronger as before. But because there is no danger, your human brain now notices these symptoms and they are uncomfortable, unwanted. Their anxiety, fear, or something negative. This experience of having Your stress response activated when there is no threat is called false positives. Over time, this part of the brain is on the lookout for you, scanning for more dangers. Being out at night, driving, crossing any bridge at all, even the railway bridge, and activates your stress response in all these situations. You start avoiding places and activities. Your survival brain thinks it's doing very well and is protecting you, but your world is becoming smaller and smaller, and you're becoming more and more anxious. You can't reassure the survival brain. It doesn't understand words. There are no connections from your language part of the brain to the survival brain. But you can do is change your behavior and teach your survival brain what is threat and what isn't. It needs to trust the human brain that it is safe to be out at night, that it is okay to drive, and it is okay to cross any bridge. In that way, both parts of the brain work together. When you need it, your stress response will be on, but it is not stopping you. Do what you need or want to do. And both brains work in harmony.
So they're all events that have happened, what you've described, Cornelia. What about if it's a psychological threat, like you've been criticised or you've got a deadline coming up? How does it work there?
Your human brain remembers past and worries about the future. In that way, it appraises a threat. The problem is, with survival brain, it doesn't understand the past or the future. For it, it's only here and now. And it activates your stress response as if the threat is current. So you can't appraise with your human brain a threat without your survival brain instigating the stress response and giving you symptoms that you really don't like. So when you predicting worst case scenarios and catastrophes, I'll get cancer, I will fail my exams, I will lose my job. These are exaggerated appraisals of threat, and your survival brain makes your body react accordingly. Anxiety is exaggerated perception of threat and your survival brain making you stronger to survive it. You can see the difficulty here. Both parts of the brain are doing what they're supposed to do, but they do not understand each other, and they do not understand the impact they're having on each other. Human brain is afraid of the help that the survival brain gives, and the survival brain is made ready when the threat is in the future or may not happen at all.
Okay, so how did EMDR become a new way of working with trauma, Cornelia?
EMDR started as a treatment for PTSD. Everything I said about the survival brain is even more pronounced with trauma. Normally, in everyday life, we process difficult situations without being aware of. But when something traumatic happens, you nearly die, or you are exposed repeatedly to distress, like in childhood abuse or neglect, your coping mechanisms are overwhelmed. And these memories are stored in their unprocessed, frozen form in the survival brain in an isolated memory network that has no connection to human brain where language is used to store memories. Because the human brain could not record properly the memory of the event or events while the survival brain was saving you. Those memories often appear as fragmented, a snippet of sound, emotion of shame, sensation of pain. They are encoded in your brain in that form without a narrative to make sense of them. With these fragments, they are easily triggered by your everyday life. You can come across the sound or sensation or similar situation, and your survival brain will transport you to then as it is now. remember, it only knows the present. Those fragments are like knots in your brain that you cannot unravel or break through. You find yourself in the worst moment of your life, again and again, experiencing once again the emotions and physical sensations in the body that you experienced at that time. And it can be frightening and sometimes terrifying. And this is when EMDR becomes indispensable.
So, Cornelia, what actually happens in an EMDR session? Can you describe it, please?
In EMDR, we go into the very memory you try so hard to avoid, but with the aim of processing it and rewriting it. Your survival brain needs to understand that the event is not happening and then the past is past. You survived it and you did very well to survive it. So we elicit memory, we elicit the image and emotion from the memory and the belief that it provoked. I am to blame, I am helpless, and we create dual awareness. The key aspect of EMDR is that you are both in the past and the present at the same time. With repeated sets that we create, the memory changes, fragments of it become more integrated with other memories and other experiences. With the encouragement from the therapist coming from now, you are safe now, it's all in the past. And being in the past and present at the same time, your brain understands that the event is over, you survive, and you are okay. The memory loses its painful intensity. Once the emotion subsides, other memories come in to create a fuller picture of what happened. More adaptive brain sees more, understands more, and learns more, and you can finally file that memory.
So just to clarify, so a memory transforms, I think would be the right word, from a memory with all the intensity of what was back there in the here and now, and it transforms to an emotional memory, but is contextualised in the past.
Yes, yeah. I think this is the most important aspect of EMDR, that we can actually correct the survival brain in as little as one session. But that is for the recent traumas. With childhood traumas, it takes a little bit longer. The child hears the messages from the environment, you're not good enough, you're not important. We again take people into those memories, and with the encouragement from the therapist, and how could a 6-year-old stop that, who provides extra information, you become aware of the reality of the past and can free yourself from inaccurate emotions of shame, guilt, and fear. I hope I demonstrated the intricate interplay between CBT and EMDR and how it brings together both the survival and the human brain.